We're now going to go to the switch to the Leaders and Partners Forum. If you're watching on social media, you can stay right where you are. You do not need to access a different stream. But conversely, if you are joining the conference platform, which is the best way, so we can hear your voice and you can speak and we can listen to you. This is particularly important if you are one of our guests of honor today. We do need you to go to this next session, and you need to have made a reservation. Otherwise, you may find yourself unable to join in. So we're going to finish now with this session with the opening ceremony, and look forward to the Leaders and Partners Forum. We'll see you there. All right, so for everyone in our Zoom studio, you'll need to, as soon as we end the session, you should go back to the conference, go back to the lobby, and find the Leaders and Partners Forum in order to be able to participate. And this is the first time we'll be doing networking. We'll see how many, and really an opportunity to meet, network, and learn in a different way. All right, here we go. Okay, so for those of you who are still watching the stream, we're setting up the right now the next session. So please hold on. Should be starting in a minute or so, and then we know. I think that's one of the issues with this. All right, here we go. We'll start.
Okay, I see you've done that already.
All right, and this is set up as a mini meeting session, so it is going to be a different configuration. Warm welcome to everyone. We do want to mute everyone. Here we go. And we're going to see. All right, we're going to make Charlotte. So this is a little bit messier than what we're used to, where we like to have a countdown, but this is also one of the benefits of this new platform for the Leaders and Partners Forum. For those of you who missed the opening ceremony, the recording should be instantly available in the lobby, as well as you can actually, if you're watching the stream on YouTube and you missed the opening ceremony and you'd like to see that, you can actually go back to... I just need to say this, thinks it is in French for some reason. So this is the Leaders and Partners Forum. A warm welcome to you. I'm looking for Charlotte to make you a co-host, Charlotte, as well as Maria. We're going to be getting started. This is a little bit not as quite as well organized because we do have to switch sessions. It's a completely new session. And let me just, in fact, we have to switch from the opening ceremony to the next session here. All right, and we still have a couple of minutes. We won't have a countdown timer, but we're here, and we hope that we won't lose. Okay, we have lost a lot of people along the way, but be that as it may, we're going to go ahead with the, let me just spotlight this for everyone. All right. And you should be able to see everyone else in the room. We're going to focus on networking in this session, and we have 2 minutes left. Let me see if I can improvise a countdown timer. It's a little bit, all right, so this one right now is at 0, but we are, okay, we have 50 seconds to go. Right, a warm welcome for those of you who are just joining. If you missed the opening ceremony, it is available both on our YouTube channel as well as on in the Teach to Reach conference platform. We have a brand new platform. You can see the upcoming session is the Leaders and Partners Forum, and that session really recommend that you figure out how to log into the platform. You've all received, for those of you who requested the invitation to Teach to Reach, you've all received the invitation from Zoom, so look for Zoom, and then that should give you, you don't need a password, you don't need anything else, you should just be able to join right away. Here we go. So we are Kicking off this session for leaders, the Leaders and Partners Forum. I'm Rida Sadki from Geneva, Switzerland, from the Geneva Learning Foundation, and part of a trio that includes Charlotte Mbu and Maria Fernanda Manzan. Maria, can you introduce yourself? Tell us where you are connecting from, how you work for health, and why you not only joined Teach to Reach, but you've now joined the Teach to Reach team.
Thanks, Rita. Well, hello all. Warm welcomes from Argentina. I'm joining from Corrientes. I'm a longtime scholar. I've participated in Teach to Reach since the very beginning, and I am a pediatrician. And as Rita was saying, I'm now part of the team. I'm very excited about this. I have worked in immunization for a long time, and I'm very excited to network with all of you in just a few minutes.
All right, wonderful. And over to you, Charlotte. What's on your mind? We just came out of the opening ceremony. A lot of experiences already being shared and many organizational leaders, whereas this forum, we're going to focus entirely on leaders and Teach to Reach partners. What's on your mind right now?
A lot of things, Reda, and hi again, everyone. I'm Charlotte Mbu, and I'm saying warm welcome to you from Ibilola, Cameroon. So already from what we got at the opening ceremony, we have very dynamic and experienced leaders with us. But one particular thing was that desire to learn more, to know more, and also to share knowledge with others. And I'm optimistic that we are going to get some of that during this forum.
All right, wonderful, Charlotte. Let's go then. So a couple of rules of engagement. First of all, let me get myself out of the way. So first of all, how to request to speak. We do ask you to raise your hand first. If you can type a message in the chat so that we know what you want to say, that can help us identify. Now, we do in this meeting format, because we're going to focus this session on networking, we are going to allow you to mute and unmute your microphones. And that is very important that you have a working configuration, otherwise you will not be able to participate. So how to network? First of all, make sure that your audio is working. So basically you need the same thing that you need to make a Zoom call, not just send a message on WhatsApp, but to make a Zoom call. So if you're able to make a call on WhatsApp, you should be able to join in this way. Now, when you see the four little white squares, that means you can join a breakout room, which will put you into a small group discussion. When you join, introduce yourself, your organization, and then share your challenge, share your experience. So if you're on the phone, this is what it's going to look like. You look for that little icon. You can see it in the red square. That's the breakout rooms, and that is how you go from the meeting where everyone is in the room in our Zoom studio to meeting with just a few people. And then the key, Charlotte, what was the problem yesterday that happened in the Reach Leaders session?
So rather the observation was that many people, when they got to the breakout rooms, they stayed muted. So I would like to encourage you today, once you access the breakout room, do not wait for anybody to start the conversation. You are a leader. So one aspect about leading is taking the initiative and launching the conversation. And I'm encouraging especially those who have participated in Teach to Reach in the past you already understand, or in past Reach sessions, you already understand what it means. Time is not on your side. So it's good to make the most of the opportunity. Thank you, Reda. Over.
Thanks a lot, Charlotte. And Maria, what would be your top tips for people joining networking, organizational leaders joining networking for the first time today?
Well, definitely it is to be concise and to take time as an important issue, because everybody would, or especially everybody who's joining now, will like to contribute, and be open-minded, listen about everybody else's challenges and what they're facing now, and have a wonderful conversation. That's the most important thing today.
All right. So our first question for the organizational leaders in the room is, why did your organization become a Teach to Reach partner? So we'd like to, you can either unmute or raise your hand and then we'll come to you. But we'd love to hear from those of you who are leaders of organizations. That can be a local government agency or health facility. That can be a non-profit or non-governmental organization. Whatever the case may be, we would love to hear from you. And that is whether you work for government or civil society. So we do see folks who have poor connectivity, like Bernard Acheompong, who say who are connecting via YouTube. So I'm glad you're able to follow the stream. Bernard, you can answer the questions that you see on screen. We're looking at your comments. There's just a slight delay. Let's go to all right. Let's go to Sujata Mana. If we can ask you to unmute, Sujata Mana, are you there? Are you able to speak to us?
I say 15 minutes. Daga 7 Monday 15.
Hello, Sujata. All right, let's okay, this always takes a little bit of time to get going, but remember, we're then going to put you into these breakout rooms. You're going to go find yourself in a small group, so there it is critical that you be able to speak, in fact. And we see we have lost a considerable number. Charlotte, this is one of the things I feared with this new platform is people do need to get into to understand that they need to switch from one Zoom session to another. When the Zoom session ends, it looks like Teach to Reach is over, which is absolutely not the case. So we hope that more participants will be joining. Let's go to Ibilola Atureta. Ibilola, are you able to speak to us? Ibilola Atureta, we hear your microphone, but...
Hello, everyone.
Yes.
Hello, good morning.
Good morning to you.
Thank you, Eddie. Thank you so much. Got your emails. Thank you, Charlotte. Yes, I'm Ibilola Atureta from Nigeria, speaking from Bauchi. Can you hear me clearly?
Yes, it's just we ask others to mute themselves if you're not speaking.
Okay.
Please go ahead, Ibilola.
Okay, so I'm a CSO working with Glorious Elixir Foundation in Bauchi State, northeastern part of Nigeria. We are actually volunteering. We do medical outreaches, to some communities here in Bauchi State. So why did we decide to join the Teach to Reach partner? So I was in some of the Teach to Reach previous.
Oh, we just lost. Okay.
Looks like we lost you, Reda.
Yep. Okay. Well, this will happen throughout the day. Okay. And
Can you hear me?
yes, you're back. Yeah.
Sorry, I got cut off. Yes. So, like I said, Ibilola Atureta, Glorious Elixir Foundation, a CSO in Bauchi State, also working volunteers. We partner with medical organizations to do health programs here in Bauchi. So we have partook of the Teach to Reach previous training sessions. Yes, and the Teach to Reach 11 is I'm glad to be part of it again. So Teach to Reach has actually exposed me to so much community and collaboration. We can learn from ourselves. Others are working also in the medical field. So I'm glad to be here in this meeting today. Thank you very much.
Thank you, Ibilola. And have you experienced the networking in small groups before? Sorry, I saw you've already muted yourself, but if you want to come back.
Yes, I have. Yes, I have.
Okay, wonderful. And all right, we'll come back. Let's hear from a couple, from at least one more person, preferably someone we have not heard yet in Teach to Reach 11, but that's not to discourage Mahesh or Kingsley, but we know there many of you, especially if this is your first time at Teach to Reach 11, we'd love to hear your voices and to hear to connect with you and to hear from you as an organizational leader, which is really the point of this this session. So let me see if we can go to Suri.
Brother, we have a mic that is open. Sheringham, Alicia. I don't know if it's an accidental unmute.
Let's find out. Alicia, are you there? Are you able to speak to us?
Yes, I'm able to speak to you.
Okay, wonderful, Alicia. Can you introduce yourself and your organization?
Yes, first of all, thanks for inviting me in this meeting. I am Sheringham Alicia. I'm a community health worker based in Nairobi, Kenya. My organization is a National Association for Community Health Workers in Kenya. It is known as ARCHVOG. ARCHVOG acronyms meaning Advocates for Community Health Volunteers of Kenya. Because initially we were called volunteers, but the name changed from volunteer to promoters. So community health workers in Kenya are known as community health promoters. So even the name, we are aspiring to change that name so that we be called Community Advocates for Community Health Promoters of Kenya. So this is my first time. I've been having problem joining the meeting due to an accessibility of network, but now actually I'm in a position whereby I can be able to be joining you. So I'm glad to be here. Thank you.
Wonderful, Alicia. Thank you very much indeed. And can you tell us why did your organization become a Teach to Reach partner? Because today's session, this particular Leaders and Partners session, it has a focus on organizational partners.
Oh. Yeah, actually, my organization decided to become a Teach to Reach partner basically because we would like to strengthen the capacity of community health promoters and align with global efforts in health education, training, and leadership development. And I believe that Teach to Reach partnership focus on improving knowledge transfer and skills among health professionals, particularly in low resource settings. And some possible reasons for joining the partnership also include capacity building, global networking, advocacy and visibility, improved health outcome, alignment with strategic goals. So I'm just happy to be one of the representative of my national association or organization. So I hope that I'll be able to learn more from Teach to Reach. Thank you.
Wonderful. Thank you very much indeed. Now, we're going to get down to business of networking, because that is what this session, the Leaders and Partners Forum, is for. At Teach to Reach, you'll see we're going to now, for anyone who is watching this from the lobby or on YouTube, unfortunately, you will not be able to join the breakout groups, and this is really why it's worth making the extra effort to track down the email from Zoom that has your registration information and that has a red button that will check you into the lobby. Once you're in the lobby, you then need to go to the Leaders and Partners Forum. You need to reserve your spot, and then actually click on join. I do want to acknowledge that there do seem to be in Western Africa and some specific countries really more severe problems than usual with connectivity. So we want to acknowledge that. That is also why it's entirely possible to participate at Teach to Reach. If you miss these sessions, there are many different ways to catch up. So Dio Gracious asked it's his first time at Teach to Reach, what does it mean to be a Teach to Reach partner? So we are going to cover that. We do have a partnership program open to local organizations. So what is a local organization? You're based in a community. Your mission is to serve community needs. It's led by community members, and you're accountable to the community served. Now, this can be either private, like an NGO, non-governmental organization, a civil society organization, or a public institution like a local government health center, whatever the case may be. So I hope, and in fact, we're now going to give you a preview of who actually is joining Teach to Reach, which organization have joined Teach to Reach as partners. We're going to show now, it's a very long list. There are over 4,000 local organizations that have participated, and I believe very impressive number, which I don't have on hand right now because it keeps changing, but we're going to show the organizations, the logos of partners that have confirmed their partnership with Teach to Reach. So here we go. It's just, we hope that you'll recognize your organization. Everyone from the Adana Foundation, AFIRD, AFEG, the Mani Orphans and Widows Welfare Service, Ghana Health Service, is a partner. We have a number of government health services and EPI teams from different countries that are also partners, global partners like JSI, the Gavi CSO constituency. You can see it's a wide range and a tremendous diversity of partners. We're really proud of this and want to warmly welcome them to the Teach to Reach family. Now, many joined for Teach to Reach 10 and have automatically been confirmed as Teach to Reach 11 partners. We hope that you recognize your organization here. They're both the Francophone and Anglophone organizations. You can see the Francophones here from different parts of Africa, as well as, I believe, Haiti. And we have more partners here again, everyone from the local government agency, local community-based organizations, all the way to global partners or international NGOs like World Vision that you can see here represented by one or more Teach to Reach participants. So we want to welcome you into the Teach to Reach family and now go into the breakout groups. So let me figure out how many. Breakout groups. We would like to have one-to-one discussions, but we're not going to be able to do that exactly. So again, the rules for how to network. We're going to do a 5-minute round to start. And for those of you watching the live stream in the lobby, you absolutely must join the session in order to be able to participate here. So we're going to start with a 5-minute round. As Charlotte said, when you come in, make sure that you unmute yourself, and the whole point is for you to be able to speak with your colleagues. Here we go. You'll be automatically taken to your breakout group. Here we go. For those of you who are watching the live stream, of course, you are not able to participate. Here we go. You should see it's quite impressive to see the room full of participants emptying in our Zoom studio, emptying and being sent to the different breakout groups for this Leaders and Partners Forum. We'll see if there's anybody who's still here, and we'll work with those who remain, who have not or who get disconnected. Whatever the case may be, I see there's a few people here, so we're going to go focus the attention on you around these questions that we have for organizational partners. Let me see. Yeah. And anyone who joins late, unfortunately, will not be able to attend a breakout group, so we'll keep you in the room here. Belinda Chimanga, a warm welcome to you. Are you able to hear me? I'm going to ask you to unmute. We'd love to hear from you, as well as Jemima. There's just a few people left here, so if you are watching the live stream, you can let us know your comments. Yes, Morris, Abiba, warm welcome to you. How are you doing?
Thank you, Rida. I'm fine.
All right. So unfortunately, you've joined the room too late to join the breakout groups right now, but we'd love to hear from you. Can you introduce yourself, introduce your organization, if you're representing your organization, or just tell us where you work and how you work for health? And then can you tell us what's the best example of a successful activity, obviously for health, led by your organization in the last year, in 2024? We'd love to first hear your introduction and then hear you respond to this question.
Okay, I'm Morris Abiba from Ghana, and then I work with the Ghana Health Service in the eastern region of Ghana, and then I work as a health promotion officer.
All right, wonderful. And can you tell me, can you give an example of a successful activity, something that you did in 2024 that worked really well, perhaps better than you expected? Oh, Maurice, there seems to be a problem now with your connectivity. Yes, go ahead.
With regards to the... Yes, please, can you hear me?
Yes, now I can. Please go ahead.
All right, okay. So with regards to 2024, we just had some few campaigns about COVID-19, and then as a health promotion officer, and then Ghana being a country with a lot of hesitancy issues, and then with my skills in health promotion, we were able to convince a few people to accept the vaccine. So through focus group discussions and then one-on-one with few community members, we're able to get some people to vaccinate them for the COVID-19. Thank you.
So that was COVID-19, and we know that Ghana Health Service really had an exemplary effort for COVID-19 vaccination. So that's. But here you're not referring to in the last year. You're speaking about something that happened earlier. All right, I think we're losing you at this point. There seems to be a connectivity issue, and as I've been saying, this will happen many different times, and it's okay. We just accept that. What's amazing about being able to connect with health workers from all over the world, we also know that everyone pretty much is going to have connectivity challenges. So thank you. So we have just a minute left for those who are really enjoying the networking in breakout rooms. Now, if you join late, we'll put you into the next round. We're going to do at least one more round of this, and for those of you who are watching, let me see, we've got Emily Barasa. Emily, I'm glad you're able to follow us on YouTube. However, you're missing on the networking, so I encourage you to go. If you are registered for Teach to Reach, you would have received the invitation confirmation and the access to join the conference platform, so you can enjoy the networking with partners and leaders. So we're going to go now to Lynn Iminari. Lynn, are you able to speak to us? We'd love to hear from you. Okay, Lynn, it seems has a problem.
Hello, can you hear me?
Yes, now I can. Lynn, a warm welcome to you. Can you introduce yourself and your organization, please?
Hi, so I'm Lena Minari, and I'm under the vaccine study group for child health and human development in the Philippines. So I'm reaching you out rather from the Philippines. Well, I would say the successful activity we've done so far this couple of years back and to this year is we have been hit by a lot of typhoons, and climate changes has been occurring over the past very much so this 2024. And as of yesterday, we're still fighting and battling typhoons, so the sensitivity and information out there on how to tackle the climate change coming in has actually created a lot of differences for us this year. We're much more prepared. We've had a couple of organizations pitch in, the United Nations pitched in, and we'll see how things goes before December rolls out.
All right, wonderful. So can you get more specific about something that your organization specifically did that made a difference in preparedness in terms of response or recovery from typhoons and other extreme weather events?
Yes, definitely. So we actually are quite prepared, and putting out the sensitization over there and making people understand here that.
I think we just lost Lynn Eminari. We'll come back to you, Lynn. We are now going, and in fact, everyone is already back from the breakout rooms. So welcome back. Yes, yes, fully agree. Ayo Maria, we're going to go into the second round. I want to hear first. We reconnect with you if. Before we hear from the breakout groups, we just wanted to cover a little bit. What are the benefits of becoming a Teach to Reach partner? There was a question about that, so I'm going to answer that now. I also want to acknowledge Kingsley Niniere has had a hand raised for a long time. So benefit number one of becoming a Teach to Reach partner is really the opportunity for your organization to share your real world knowledge and earn recognition for that knowledge. Your team's daily work makes you experts about how you do that daily work. You know things because you are there every day that no one else does. And Teach to Reach lets you share this valuable knowledge with others worldwide. Second benefit is to learn from other organizations. So by sharing experience, every organization teaches and learns at the same time. The benefit number three, you become part of a global platform. So whatever the size, the scale of your organization, your area of intervention, whether it is a single community, several communities, a district, a region, or the country. You become part of a global platform, network, and community. Together, we're betting that we can make bigger changes than any one group could possibly do so alone. And then benefit number 4 is really to grow your skills through active learning, and your staff and volunteers can practice sharing their ideas with people from around the world. Now, the reason we're doing this Leaders and Partners Forum is because something amazing happened with Teach to Reach 10. Over 4,000 local organizations joined Teach to Reach 10. We saw rapid growth from up to 21,398 registered participants, and even more so for Teach to Reach 11. We're getting close to that 25,000 mark. Now, I want to turn to the folks who went into the breakout rooms just to hear from one or two people how their breakout session went. So please do unmute yourself. You should be able to unmute without raising your hand. Let's go to Rashida Musa Mukadas. Were you able to join the breakout room? And if so, how were you able to introduce yourself and hear the introductions of others? All right. Dr. Tusimi Ramadan, would you like to? Okay, Rashida, if Rashida is not available to speak with someone.
I was, hello, brother.
Yes,
Good
Rashida,
morning.
yes, please go ahead.
Morning. And actually, I wasn't able to join the breakout room. Actually, I was just joining because of my connectivity.
Okay, we'll see. Please do raise your hand. There are 3 hands raised now. So let's go to Eda Kanini. Eda Kanini, please go ahead and tell us how were you able to introduce yourself and hear the introductions of colleagues who were part of the Leaders and Partners Forum at Teach to Reach 11.
Yes, thank you, Reda. I was able to join the breakout room. We were 5 of us. We managed to introduce ourselves, at least 4 of us. The 5th one, maybe she or he had a connectivity challenge. So it was good, but we were not able to discuss much. Just after the introduction, then the time was over and we were brought back to the main room.
All right, wonderful. So I do have good news. We're going to go right back into. We just wanted to hear if there are others who would like to contribute to that. Let's go. I want to hear from Kingsley because he's had his hand up for such a long time. Kingsley, you stayed with us in the plenary, but are you going to go into the networking session now?
Okay.
Yes. All right. And Mario, would you like to? Were you able to introduce yourself and hear the introductions of others?
The introductory was great. I really must say that the people that I met with gave me crucial insights on what they are facing on day to day, and we were able to discuss a little bit of challenges in there as well. So thank you for this opportunity, and I'm looking forward for the next networking session.
All right. So let's, without any further ado. Yes?
I wanted to say something before we go back to the networking sessions. Just to encourage those that are having connectivity issues, that one thing you can do during the group networking, even if you can't speak, please use the chat. You can introduce yourself in the chat. You can share your thoughts in the chat. That way you can contribute to the conversation and the experience sharing. Thank you, Reda.
Wonderful. And here is the question. Now we're going to go into a 10-minute networking round. And again, we've asked you this question, and if you've been intensely participating, it may feel like we keep asking the same question over and over. But here are 2 questions. What is the biggest challenge faced by your community, and how does your organization help? So we're going to give you 10 minutes to go back to the same groups. Now, we are going to allow you to choose the room and to allow you to return to the main session at any time, but you'll still be automatically moved into the breakout room. So let's see how that works. We have not done that before. We usually put you sort of lock the room when you go into it. You should find yourself with the same colleagues you were in with before. We will try to assign the newcomers or late joiners, but we do need some people to stay in the room with us for 10 minutes. So please, here we go. You should find yourself. So the question for discussion is, what is the biggest challenge faced by your community? How does your organization help? Here we go. we're almost, yeah. So you should now see what's going to be different this time is you're going to see this little breakout room icon. If you see that, that means you can actually choose and put yourself into whichever room you like. So if we do ask that some of you, for those of you who stay here, well, we're going to do a breakout room in the plenary session. So Benson, you can, if you look at your screen, if you're on your phone, just look down and scroll or swipe until you see the breakout room, and then you can choose which room you want to go into. They're just generic rooms, room 1, 2, 3, 4, 5. So you can just go through that. But we're going to focus on this question then. And this question we have discussed in the Reach for Leaders session in particular. So we'd like to hear from more of your voices here. Let's go to, let me see, to Sunny Katagum. I'm going to ask you to unmute, as well as Saidu Yabagi, Otieno Bernard, Olajumoke, Olofudipe. Otieno Bernard, I just saw Saidu Yabagi. Yes, are you there? Are you able to speak to us?
Yes, I'm here. I'm able to speak.
All right, Saidu, could you introduce yourself and introduce your organization?
Okay, I'm Said Diabagi, a pharmacist practicing in the community practice in Nigeria. I work with an organization, a new organization actually, still in its early phases, called the Fresh Breeze Initiative. In terms of health, we actually working towards seeing how we can improve the healthcare system in Nigeria in general. Currently, we are based in the northeastern part of Nigeria, where the
Oh, we just lost Saidu. That sounded very interesting. We'll come back to you, Saidu. For some reason, we lost your audio. I just want to make sure it's not. Are you still able to? If others are still able to hear me, and it's not and then that I'm not the one who's lost the sound. Are you? If somebody could confirm in the chat, that'd be appreciated while everyone is in the breakout room. All right, let me just... All right, so if you're still here, you are able to choose... you are able to join the breakout room. This is how you do it. So you look for the little, the 4 white squares that you should see on your screen, and then you will be able to join the room of your choice. You're also welcome to stay here. We're going to discuss the questions that are being discussed in the breakout room, and this is particularly important because we have folks who are watching the live stream. So that would leave a gap if we didn't have at least a few people, so we can have the discussion. So we wanted you to introduce yourself and your organization, and then tell us what is the best example of a successful activity led by your organization in the last year. And of course, this is a recurring question. We're really big on, we think that in order to solve problems, we first need to identify what are the challenges that you face, and to understand better how your organization is helping. So I'm sorry, Saidu, we could not hear from you. I hope you're still able to connect. I'm going to see if Gloria Anyanwu or maybe Noel Ano are able to speak to us. Noel, are you there? Are you able to speak? Okay, Noel Ano, you sound...
network challenges.
Okay.
Network channel. I cannot join you. I not join the group.
Yes, Olajumoke, we just showed the instructions, but I'll send you to a group right after you introduce yourself and your organization.
Good morning, Dr. Reda. Are you hearing me?
Yes, we hear you loud and clear.
Okay, good morning. I'm Mrs. Olufidipe Olajumoke, a retired nurse, but a fellow of West African College of Nursing. Then, after retirement, I've joined the community to be assisting with immunization. And thank God, in our area, we are able to solve certain issues. Last year, issue of hesitancy was discouraged due to awareness in the community. We go to the community in my domain, Agege. I'm living in Lagos, Nigeria, and Agege to precise. So we discuss with the leaders in the community. We use the church leaders to assist, to talk to the women in the church. And during the period, we used Sunday school when the children are in the church to immunize some of them. That's how far we have gone. Thank you.
Thank you very much indeed. Let's go to, all right, so let me now send you to one of the rooms. We'll send you to, let's see, to room 2, where right now you'll be discussing with Eda Kani and Shuaibu Kaltimi. So back to our plenary, we're discussing, so this is the Leaders and Partners Forum. We're really with organizational partners of Teach to Reach, represented by a range of people who have also brought colleagues this time around. So it's really quite a remarkable experience we're having this morning in Geneva, afternoon or evening, depending on where you are. We take note that some of you are in rural areas and have erratic internet. And so sorry, Adebayo, you'll be able to catch up. We do have a plan, if you're not able to connect to the live sessions, for you to be able to join. So let's now go to Ifeoma Osai. All right, and it looks like Ola Jumokema, despite the challenges you are trying to unmute. We heard a little bit from Saidu.
Okay. Please, can you hear me now?
Yes, I do. Yes, indeed. So please, can you repeat who you are, how you work for health, and then tell us about your challenges, as well as an example of a successful activity that your organization did in this last year.
Okay. Like I said before, I'm a pharmacist. My name is Saidu Abagi. I'm from Nigeria. So recently, my organization is called the Fresh Bridge Initiative. So recently, we assisted in with the air challenges during the recent flood in Borno State, that's in Maiduguri. My organization was able to source some items for the displaced persons, and also assisted the pregnant women who are having some air challenges, pregnant women who were displaced into the IDP camps during the flood. Were able to assist them with some materials for their health, even assisted some with delivery, because we have various health personnel, both nurses, medical doctors, and various health personnel in our team. Currently, is a new organization, just started. We just got our registration last year, early last year, we got our registration. So we are still in our early phases. So we face a lot of challenges when it comes to personnel and funding. I think funding is one of the major challenges that we are facing right now as an organization. But we are trying our best to see how we can help with most of the challenges, especially in the northeastern part of the country, where terrorism is actually hindering a lot of things, and a lot of people are suffering due to inability to access health facilities and so on. Yes.
Thank you very much indeed, Saidu Yabagi, for sharing your account of the work that you and your organization are doing. We have a number of questions that we were hoping to discuss with leaders and partners. We started the discussion yesterday. For those of you who are watching the live stream, please do share your comments. There is a slight delay, but we are paying attention to your comments, and we'll show them on screen if we're not able to read them. And of course, we cannot discuss them with you. Let's see. We have 26 seconds before the leaders and partners who are meeting in breakout rooms come back. If you join late for this session, or if you're using a very old version of Zoom, you may not be able to have joined those breakout room sessions. We do have time for one more, so we'll hear from the group again to what extent the groups were able to discuss this question. Let me just close the rooms here. Yep. And then we will we'll go back for one final round. This is really one of the best parts of Teach to Reach, where rather than being hearing just a few people talk, you can really engage in small group discussions. We encourage you to share your contact details. And if you registered in Zoom, so by default, you get just a magic link that takes you to the conference. But if you actually register in Zoom, you can access the participant list of Teach to Reach. And you can see here everyone who's currently participating in Teach to Reach, and you can chat with them. You can also go to the here. You can go to the People tab, and here you can do a lot more. You can see people who've filled in their profiles and really interact with them and reach out to them. So you can, I think it's when you hover over this, you click on the plus. But you can see that in order to connect with other users, you need to log in with Zoom. All right, I think everyone is now coming back to the room. That's it. All right. This is our Leaders and Partners Forum. We've just had the second round. The first one was just an icebreaker for introductions. So really looking forward to hearing how it went. I'm going to turn to my co-host, Maria Fernanda Manzan. I know that she and Charlotte were visiting the rooms and seeing to see how the discussion goes. Maria, what's your summary of what happened in those 10 minutes? It's a really short time to share on a very big question about the biggest challenges faced by your community and what your organization is doing about it. What did you see?
Well, Rita, I was in a room that had 3 participants that were very, they had very clear understanding on what their challenges were. We went from the Himalayas to Kenya to Ghana, and everybody was sharing. It was incredibly interesting, and it was a very nice discussion. Short, 10 minutes is short, but it's very good to hear from other places. So very interesting.
All right, thanks, Maria, for that. So that's actually your experience as a co-host. Let's hear now. Please raise your hand or just simply unmute if you were able to participate in the small group discussion. So ideally, we would match people 1-to-1. This is what we were able to do in previous Teach to Reaches. This time, we're trying small group discussion. So please raise your hand if you'd like to share how it went for you. What did you share and what did you hear? Chinwe Enechuku, a warm welcome to you. Do introduce yourself. I hope you're going to be able to speak to us.
Yes, I am quite excited about the event of the day. The group went well. The room breakout was fantastic. I have the opportunity to meet with 4 people: Esther, Ndeyo, Elisha, Adedamola. They are all awesome. They shared their problems, the biggest challenges that they are having. Esther from Ghana said that their organization is having a staffing issue. Ndeyo from Abuja shared about the problem with liaison with the community, shortage of vaccine. I don't know whether I get that correctly, but it's all about the community having the vaccine at their beck and call. Elisha from I think Elisha from Kenya states that theirs is about policy change. He's trying to make a decision, a way of having the community health workers partake in the decision making. And Ade Damola from Ondo State is having the challenge of endemic Lassa fever. The community accepting the vaccine and not seeing it as it's being imposed on them. It's a wonderful room, and I would love to go back and continue with the discussion. Thank you.
All right, thank you very much indeed. So I have good news. We are going to do exactly that. And because we're going into, if you look at the schedule, we're going into the lunch break. Now, this is new. In the past, Charlotte, Maria, and I have gone nonstop from very early in the morning to late in the afternoon. So in a way, I would say, Charlotte, this is in part for us, but I think it will help participants who are really attending all the sessions. We do have this lunch break, so we'll be able to extend the networking a little bit. If you're enjoying the Leaders and Partners networking, we have then a general, not the Lancet Countdown, that's something else that we're doing, but we also have a general networking session that will be happening in this afternoon, and that'll be with everyone. This is really focused on leaders and partners, so we'll have a different set of questions, but the same opportunity to really meet, network, and learn after the sessions that we expect to be very intense on malaria, the Nigeria Immunization Agenda 2030 Collaborative, and climate change and health. I'm going to go to Charlotte now to guide us to see who we're going to hear from. We love to hear from new people whose voices we haven't heard before. Charlotte, who shall we hear from next?
So right now, Otieno Bernard, whose mic is already unmuted.
Thank you very much. This is Bernard Otieno. Bernard Otieno is a community health worker from Migori, Kenya. Actually, I just joined when people were breaking out to the break rooms, and I did not have the opportunity to join. So I'm representing an organization that just started something like 1 year ago. It's a group of community health workers that are trying to work with the community to curb the issue of malaria. We come from a place which is very much malaria endemic, and so we are trying to come up with some issues that can help the community. So I hope, having come to this organization, I'll have the partnership, or maybe getting the network from the various people who will be helping us. The major challenge that we still have up to now is funding, because it's just but a small organization that has about 50 people, community health workers coming together. Otherwise, let me stay tuned for the much that we'll get from here. Thank you very much.
Thank you very much indeed. So let me see if there's anyone else who'd like to share back. Otherwise, I suggest we just go right back. Yes.
I wanted to invite, so we have Timothy Ngandu, Dr. Timothy, whose mic is unmuted. Are you able to share how the group networking went for you?
Yeah, good day, everyone. Just like I said initially in a breakout room, that I'm a new timer here, and the challenge I had is about learning about the challenges facing my community. So Musa shared the indices that I can use to see all those challenges. It was really awesome, and I've learned a great deal on how to check for challenges so that I can look for solutions to cause those challenges. Thank you.
All right, wonderful. Thank you, Timothy. You were in room 3 with Timothy. So you're Timothy with Musa Karimu, but also Abdul Razak Ahmad and Rashida Musa Mukadas. So let's see if we can perhaps hear from some of them as well. Let me see. Yeah. Oh,
Musa Karimu is unmuted.
All right.
Hello.
Yes, we get you loud and clear. What was your experience of the small group discussion?
I think for the doctor, you will even have my contact so that I can suggest maybe some proposal for him and how to reach a community, and then how to supervise interventions or core, so that he will have a skill project. Small skill project that can help him to help his community.
Wonderful. Now we have Tijani Suleiman as well. Tijani, please, you should be able to go ahead and unmute yourself. Tell us if you were able to participate in the small group discussion, how it went for you. And then we'll go right back in. You'll find yourselves with the same people. You can change rooms if you want to this time, but we'll give you 15 minutes before we close down this session for our lunch break. Tijani, what would you like to share?
Yes. Good afternoon to you all. So I have already joined. What happened is that there's a little break up, so that's why I didn't introduce myself properly. As you all know, I'm Tijani Suleiman from Zamfara and Zamfara State, and previously I worked with a government agency as the head of one of the hospitals, and I work with a international organization like
All right, this has happened to a number of participants. Tijani, we lost your audio. I suspect that this is linked to some of the bugs in the conference in our conference platform. This is a brand new Teach to Reach platform, and you like it or not, the only way to find out how well it works is to run Teach to Reach 11. But this is the first time. So Tijani, this may be on your side, but I suspect, given the number of people who've been breaking up in the middle, okay, it sounds like you haven't been hearing me. Yeah, Tijani, unfortunately, you cut out for us. Please do raise your hand. We'll take maybe one more comment. There does seem to have been a lot of positive experiences in the small breakout groups. Before we go back into the breakouts, maybe hear from one more person. Please do check your connectivity. Obviously, it's important to participate for this networking session. A reminder as well of what is coming this afternoon before we go back into the breakout sessions. And Charlotte, do interrupt me if you see that there are hands going up or microphones unmuting. So we've been this morning through the opening ceremony and the Leaders and Partners Forum. This afternoon, we're kicking off, and this is going to be a very powerful, moving session. 4 months ago, the Nigeria Immunization Agenda 2030 Collaborative was launched by a group of more than 4,300 Nigerian health workers, really bringing the Immunization Agenda 2030 to every state and more than 300 local government areas. You'll be hearing firsthand from health leaders in this collaborative. That'll be to a little bit more than 1 hour from now. Then we'll be going to yes.
Benson Uchenna, hand raised, mic unmuted.
All right, let's hear from Uchenna. Yes.
Good morning, everyone. Good day. Thanks to hear from me. Although I came in a bit late due to trying to hook up with the network and every other so far. But when I came in, I happened to join the group because I came when the room was breaking out, and I happened to fall in group 7. And thereabout, I get to meet our host, the Emmanuel Ambrose, Lewan Grace Alonge from Zambia. And we share a very good experience on what we faced in our community and how our organizations were able to profile some of this. Like the area of Grace Komlangwe from Zambia, it's an eye-opening to understand that there's a kind of preventive malaria treatment for pregnancy women especially, which is being administered. And the new artesunate kind of treatment for severe malaria cases like that. And the one thing that got me much interest is that they are trying to leverage, trying to get the performances of the new malaria treatment. So I think it was a brief discussion, though time was not there for everyone to share their own view towards it before. But thank you. As the next session continues on climate change and others, then we follow suit. Thank you.
Thank you very much indeed, Uchenna. So let's go back. We're going to have 15 more minutes. We encourage you to share your contact details, to get to know each other as organizations. Just so you know, if you can figure out the platform, you'll gain a kind of superpower to connect with people. You can see here at the top right, you can connect. You have the full participant list of more than 15,000 participants, but in order to connect, you need to be registered in Zoom. So you've accessed this usually with a link that you received by email, and that's good to participate in the sessions, but to really benefit from the networking, you need to go to the People tab and set up your own profile. Then you can begin to do really interesting things to stay in touch with some of the folks who have also registered on the platform. This is optional, but it's better than trying to swap WhatsApp in a 10 or 15 minute session. I'm going to tell you a little bit more about what is going to happen this afternoon. As we said, we have the Nigeria Movement for Immunization Agenda 2030 that will be sharing 4 months after having launched this remarkable countrywide movement present in every state in over 300 local government areas. And this will be part of our celebration, the celebration that began at Teach to Reach 10 about the power of vaccines and the 50 years of the expanded program on immunization. So be hearing firsthand from them. We'll then move from Nigerians who will be, so this, when we invite, of course, people from participants from every other country to listen in to see what Nigeria has been able to do by really connecting health workers to each other. Then we'll have the session on malaria. This is actually a sneak preview ahead of the special event that will be taking place this afternoon. We'll be asking you again questions to share your experiences with malaria. And then climate, health, risks and barriers will be next. This is a session with Grand Challenges Canada following the partnership with RBM, Partnership to End Malaria. Again, there will be asking you to share your experiences with climate change impacts on health from the perspective that only you have and only you can have because you are there every day. So with that said, let's get back into it. This is the Leaders and Partners Forum, and we'll be putting you back into breakout rooms. We're going to close the session, close the morning live stream for those of you who are watching on YouTube, and we're going to put this time everyone into breakout rooms. Let's start now. All right, so you should find yourself, if you haven't been assigned to a room this time, Charlotte, I can take the list from the bottom if you take the list from the top, so that way everyone gets to go into a breakout. All right, for those of you who are watching the live stream, we're assigning everyone to breakout rooms. It's partly a manual process for people who join late. That's one more reason to ask everyone to join on time if you want to get the full benefit of networking. So, and this ends the morning session of Teach to Reach. We're going to be closing the live stream in 3 minutes. Give a short recap of a few of the things that we went over today. And as soon as we're finished assigning everyone to a breakout room so that you can get the full benefit of this networking session. We're finishing this morning in Geneva. It may be afternoon or evening for you, but whatever the case, we're grateful that you have joined us, and really appreciating the level and the quality of the interactions and the leadership that so many of you have displayed. We're still doing the assignments, so please be patient if you are still with us in the plenary. We're working on getting everyone assigned to a room so you can really enjoy the networking. Yes.
Hello, good morning.
All right, we're closing this plenary session, and we're closing the live stream. So for anyone who's just joined, we're assigning you to one of the rooms. I think we've got everyone assigned now. So if you're still in the plenary with us, well, yeah, this usually happens. Everyone's been assigned, so look for. Let me show again how you actually locate the breakout room. So look for the 4 little squares, and you should be able to get to your own to one of the breakout rooms. If that doesn't work for you, please unmute and let me know. Adamu Gamawa, do you see the 4 little squares on your Zoom? If you're
Yes, yes, sir.
Okay, so you click there, and then you should see the breakout rooms, and you can actually decide which room you want to join. Right now, we have groups of 6 or 7 people. Ideally, it would be 1-to-1, but we're never sure if the other person is going to have connectivity, is going to be able to speak. So that's why the group may be a little bit larger. So what you see on your screen is what you need to do in order to.
Okay, I should just click any of the rooms. There are 12 rooms here.
Yes, exactly. All right, and here we go. We're finishing this morning session. We had the warm-up and tutorial and the opening ceremony. We asked you what is Teach to Reach in one sentence and what Teach to Reach sessions you're going to join today. We told you about what is Teach to Reach, and the last June session that had 21,398 participants. Teach to Reach is a step-by-step process. We start by asking you questions before Teach to Reach. There's really peer learning in plenary where we ask you questions and you share experience. We then do small group networking or one-to-one networking in some cases. We then have more sessions, and you can see the full program here. We really encourage you to join the conference platform in order to fully benefit from the different sessions. Let me see if I can take us to the lobby to see what's happening there. All right, for Umar Pela Abdulra, for example, who says, I'm yet to be assigned to a room. You need to join the session. How do you join the session? We explained this in the morning. You do need to, let me show you how it works. So in my case, I've already made a reservation, but what you really need to do is actually, where did the session go? Yeah, is to reserve a spot. And only by reserving a spot can you actually then join the session. So that's really important. Otherwise, you'll be missing out on the session. All right. And so I think we're going to end here for this Teach to Reach morning. And we hope that you'll stay on. We're giving a lunch break. And so for those of you who are attending the whole day, as our team is, and really looking forward to reconnecting. The next session, the first session we'll be starting with in 2 hours, 1 hour, is the Nigeria Movement for Immunization Agenda 2030. So double check the time. It is 12 p.m. West Africa time for those of you who are in West Africa. Check the conference platform where you should see the time in your time zone. Make sure you do not get confused there. And we'll see you in an hour. For those of you who are in the Zoom studio, so we're closing down the stream. But for those of you who are here, we are going to continue to keep this conference open in order to allow everyone to finish enjoying networking.